Welcome. Can everybody hear me?
Yes.
Yes, we can hear you.
All right. Well, we'll go ahead and get started. Thanks for making time and happy Friday. We'll send out these notes, but I'll just go through my PowerPoint. Hopefully you can see the screen. And here's our agenda for today. We're going to talk about COVID, flu, a couple of other respiratory, sorry about the misspelling there, illnesses, monkeypox updates, STDs, including HIV and Hep C and congenital syphilis, as well as some interesting kind of updates that are FYI, and hopefully will stay just FYI, about salmonella coming from Mexico, Ebola coming from the African continent, and carbapenem-resistant organisms coming from overuse of antibiotics right here in the good old USA. We'll end with fentanyl and MAT. All right, so in terms of COVID, thank you to Sam for putting together some of these slides. These are really great. We're actually going to put out a press release for the general public, but you are going to get to hear this first. We have been able to sequence, or actually the state has helped us to sequence the first sample of something called the BQ1 variant here in Fresno County. This is a subvariant that's pretty aggressive. It's already like the second most common subvariant, although the BA5 remains 77%. This one is occupying about 5% of the sequencing that has been going on in Region 9, which covers like a bunch of the Western states. So we know that nationally, this thing is moving quickly. The reason that it's a variant of concern is that it has short doubling times, meaning that it can spread pretty quickly, and that it's quite contagious. We're not sure if it's more virulent. We suspect that it's probably not, but it could evade immunity just because of the way that it's shaped, et cetera, for some of the antivirals and other, antibody treatments, et cetera, that we can try to offer our sickest patients. The bottom line is the boosters will still work. This is an Omicron variant. We know that the boosters are quite effective against Omicron, and we really want to push boosters for the next few weeks because overall our numbers are low, but this variant can and will be responsible for some of the fall surge and winter surge that we are anticipating. But we have a few weeks to really get people to get their vaccines. So please, please, please take time to have these conversations. In terms of our numbers, we're actually not doing too bad. We are in sort of this overall decline that we're seeing across the state. And here's what our hospitalizations are doing. There's 59 currently, as of just a couple of days ago, hospitalized. That's a really good number for us here in Fresno County. Really anything under 100 is great. And this one is on its way down. So that's nice to see. And then here's kind of what the metrics are looking like just from, for like since May, basically. And here you can see that we were as low as 1.9 back in May. I'm looking at the health equity metric, but you can look at any of these positivity rates, et cetera. But we are kind of coming down towards that nadir, as it were, as is the rest of the state, which is shown on the right part of this slide. And so that's good. We're paralleling the really nice numbers that we're seeing statewide, and we're hoping to keep that going as long as possible, knowing that there is probably at least a speed bump, if not an actual surge, coming up around the winter holidays. This is the vaccination dashboard. Again, you can access this anytime on our data dashboard. This shows that 61% of our residents are fully vaccinated. That's pretty good. Some counties are up to 80, almost 90%. What it means for a county as large as Fresno, which has 1 million residents, is that there's still a few 100,000 people that are probably quite vulnerable. And remember, these vaccines don't reflect like boosters. These are basically just one dose of vaccine, or just the first 2 doses of their vaccines, not necessarily the recent boosters, which really they're hard to track down. And we know that probably that number is a fraction. Like we're estimating around 300,000 people have gotten boosters. Those numbers always kind of lag. We'll take anything. If a person gets their 2 vaccine initial dose, that's great. Now we're really pushing the boosters because we know that the bivalent boosters are going to protect people against Omicron. And that's really what you should be having these conversations with your folks about, to say, even if you've had COVID, even if you went and got your vaccines a year ago, you're now due to get your booster. Go ahead and get it. That's really what's going to keep you in good shape for this fall. And along with that, get your flu shot too. We're not doing as well with the under 17 years group. So these are the school age vaccinations. Here you see it's broken out by 0 to 4 years, 5 to 11 years, 12 to 17 years, and 0 to 17 years. So that's like the total pediatric population. We have a lot of room to improve, especially that school group, that 5 to 11 school group, that elementary school group. We know that there's about 100,000 of those kids. We really need those kids to get their bivalent shot. It just got approved. That was one of the little last bullet points on my first slide. The bivalent is now approved for ages over 5. So that's going to be another kind of press release advisory that we're working on. If you're aged over 5, you should really get a bivalent shot or a booster. And we just have a very small number of kids that have gotten that. We need to talk to our families and do better, because this is the time when they're in school, it's fall, they're going to be indoors coughing all over each other. No one is wearing masks. We're looking at a lot of absenteeism risk, going all the way from now till Christmas vacation and beyond, just because this population is not as protected as they could be. San Diego is already reporting a lot of absenteeism, whether it's from COVID or something else. So this is circulating in our congregate settings like schools. COVID is not over, and we know which populations are at higher risk. Kids are actually quite resilient. They do well, knock on wood. However, we know that they can still be hospitalized. They can still suffer some of the complications, and they're going to miss school and sports, which is very disruptive for everyone. So please talk to the families. If you're treating pediatric age population, have this talk with the family. Say, look, the safety record is there. You don't need to hesitate any longer. There's so much data that these are safe and effective. You just need to go ahead and get your shot. Make this a regular childhood vaccination, the way that you do with everything else. In terms of the flu, we're offering a lot of different flu clinics. You could find a bunch of information on a flu page that we're maintaining, including weekly flu trends. And then just the 2 shots that I'm sharing on this slide include the health officer order, which requires your healthcare workers to get their flu shot. And you need to work that out with your employees. And also, for the general public and for any employees that have not yet gotten their flu vaccine, they can take advantage of our mass vaccination events that are going on all the way until November. There's lots of different opportunities. So please make sure that you share this and post this. You've got a link to the PDF. You can literally print this out and post this all over your organization and just send it to all of your employees and your staff, so they have lots of opportunities to go get their flu shots if you're not offering them in-house. And if you are offering them in-house, muchas gracias. There's some respiratory viruses that we don't talk a lot about. Pediatricians certainly know about this, but they've kind of been the subject of some advisories that we may or may not have covered. I know that we're sending you a lot of different emails, so I just wanted to talk about this and give you a chance to ask any questions about it. There's kind of 3 different viruses in play that we're a little worried about. 2 of them are considered enteroviruses, and then the third one is called respiratory syncytial virus. Mostly pediatric age groups that are affected, although anyone can get affected. And if adults have lung disease, then we do worry about them. But basically, the rhinovirus enterovirus group has something called EVD68, which can cause severe respiratory illness and then also go on to cause something called acute flaccid myelitis, which is basically a polio-like syndrome. You'll remember that this got a lot of news headlines and stuff way before COVID. This was like back in 2018 or 2020 that, people were describing higher rates of this complication from this respiratory illness. Well, this is back. It seems to have a 2-year pattern, and this is back this year. So we're just letting everyone know, please test. Usually you have a respiratory panel, especially at the level of the hospital, or you can work with your outpatient labs like Quest, et cetera, to get a respiratory panel that will check for enteroviruses. And then you can actually get special testing done for the D68. There's actually no vaccines for these. As far as I know, there's not an RSV vaccine either. However, the one thing that you can do for patients that are at higher risk for RSV is to offer a prophylactic antibody called pavlivizumab. And that is something that the AAP actually recommends, is to say, if you've got high-risk babies that are going to catch RSV, you can just actually pre-treat them with this antibody that will actually protect them, and it lasts for several months, and they can get it several times a year. And all of that is documented in the 2 links at the bottom of this page. So just FYI, these are, again, if you're treating kids, God bless you. There's a lot to know about, and hopefully you are on top of this. But for the rest of us, this is something else that we just need to be generally knowledgeable about and spread good information to let people know, look, it's not just COVID. If you test yourself for COVID at home and it's negative, there may be some other stuff going on, and that goes on to lead to complications, et cetera. So we all need to be kind of up to date about what those complications might be and how to work those up, which really requires this panel testing for other respiratory viruses. All right, any questions about that, about all of those slides so far? I'm gonna switch gears and talk about MPX or monkeypox if there's no questions. I'll just check the chat real quick. I know Sim is, as usual, doing an awesome job sharing all these links in the chat for you. If you have any questions, you can throw them in the chat or just unmute yourself, and please follow along. We'll send out these slides that have all these links as well. All right, let's talk about MPX. So we actually have about 50 cases, more or less. We are slowly adding to that number. And so much has changed in the last, 6 weeks or so that we decided to do another health update just to kind of summarize all of the changes with MPX statewide and here in Fresno County. And so what you're looking at is a screenshot of the draft of the health update that you are going to get in your inbox hopefully soon. And it will basically just say, California's had over 5,000 cases. Fresno County has had approximately 50 cases. We know that this is still primarily driven by sexual contact and intimate contact. So we really just need to be aware that, there's some patients that they have high risk lives, whether they're, have multiple sex partners, they're a sex worker, their partner is not monogamous, and those that are immunocompromised are at even higher risk. And so we know who the high risk patients are. We really need to work hard to protect them. And now that we have a vaccine that's widely available and supplies are not limited, we really need to identify who those high risk groups are and really get vaccines to them sooner rather than later. There's also some very interesting and concerning evidence that there's racial inequalities where Black and Hispanic patients are really getting MPX at higher rates, and they're not getting the vaccine at proportional rates either. So they're basically overrepresented in the diagnosis and underrepresented among those who have access to vaccines. And that has to do with probably several factors, related to messaging, social determinants of health, how they access care, whether they have a medical home, et cetera. And so we know that, there's several factors that are contributing to this racial disparity. However, knowing that it's there means that, we have some work to do in addressing it. So we need to make sure that our messaging, our instructions, and our services are offered to these higher risk populations. Okay. Non-sexual transmission is also described primarily among household contact. And so there's a lot of guidance actually related to that about how to keep people safe within their own home. Some people are actually choosing to stay at a hotel, which raises some interesting implications about, how do we work with the hotel and their staff to make sure that the housekeeping staff are as safe as possible. Please, reach out to us if you hear about patients that are checking into hotels. Our team is actually quite good and experienced at working in that scenario, and they want to do right by everyone involved at the same time as, protecting the patient's privacy and being sensitive to stigma that may arise from disclosing that diagnosis. We also want to make sure that we're protecting the hotel staff and other congregate settings like, shelters, et cetera, jails. Our team's working on all of those situations as they come up. So just, keep that communication loop closed and as tight as possible by getting us involved early, so that we can kind of help people stay safe and make sure that they have all the information that they need, regardless of what setting they're in. Obviously, if they have their own room in their own house in their own bathroom, that's ideal. But we know that a lot of patients don't or choose not to stay in their own house when they have this highly contagious disease. And so, we need to make sure that they have the information they need and that they're not spreading it to other folks, because we know non-sexual transmission can also occur. Not happening as much as sexual transmission, but it is another route that's been well described for MPX transmission. All right, if you have employees that are, that you need to protect or that are worried, the Cal OSHA guidance is now out, and it really discusses, what to do in the occupational health and safety setting with regards to MPX. Basically, what I kind of narrow it down to in a nutshell is wear full PPE, which is, the gown, the gloves, the eye protection, the N95 mask, and use a negative pressure room if one is available. You have to do it if they're going to stay within longer than 5 hours. Then you have to get them into a negative pressure room. If they're going to be dispositioned and out of your clinic setting or out of your hospital setting in less than 5 hours, then it's probably okay just to have their own room or their own space, so that other people are not directly affected by any airborne aerosolization that might happen. That's a very, very small route of transmission, but it is something just to be cognizant of. But I just call that the 5-hour rule, that basically if the person's getting worked up and the team decides that they're going to be admitted, or you're just overseeing an inpatient setting, then basically if they're going to stay longer than 5 hours, they need to be in a negative pressure room. And please reach out to us if you have any questions about that. Moving forward, we have new criteria for vaccination. And really the only thing that's changed, or the massive thing that's changed, is that anyone with HIV should really get vaccinated with the Jynneos product. And that's just because HIV and MPX is just happening very commonly. Like up to 40% of patients with MPX have HIV, or they've been diagnosed with an STD in the last 12 months. And patients with HIV land in the hospital at much greater rates. They just don't do well whenever they get monkeypox, because this can really cause kind of an overwhelming burden of infection, secondary infections, and sepsis. The few fatalities that have happened with MPX around the world have been very, very closely associated with HIV positive individuals. So the state went ahead and made this recommendations, and we adopted it here locally to say anyone with HIV should really be offered and compelled to get the Jynneos product. And remember, that's a 2-dose vaccine. They have to come back 28 days later to get their second dose. In terms of who gets treated, certainly patients with HIV, but not just those patients. They basically, sorry, there's a bunch of typos in here because I was dictating, but basically the tecovirimat is something that is offered by the UCSF Fresno ID team, and they will basically come meet your patient. Sometimes they'll meet them in the parking lot. Hopefully they can find another space in your own clinic to meet them, or accommodate them somewhere near the UCSF Fresno clinic settings, and basically give them this oral medication that works really well to reverse the course and really abate the course of the MPX. For patients that can take it and get access to it, they really clear up right away. And so the UCSF Fresno ID team has thankfully stepped into this space and is offering it if patients get referred to them. I'll clean this up before we send this out so that there's not any typos. And I'll also add the link to the advisory that gives you all the details about who qualifies for TPOXX. Certainly HIV positive patients would, people that are having really severe lesions or lesions that are anatomically sensitive or leading to complications like dehydration or urethritis, et cetera, would also qualify. And we will send out the link that has all of the information, including how to call the UCSF Fresno ID team. They're tremendously responsive, and I'm so thankful for Dr. Geeta Siva Subramaniam and Alyssa Hughes, who are kind of leading the charge when it comes to the TPOXX treatment, and they will basically be able to accommodate your patient and help them out. Okay. Any questions about that? All right. More guidances. Like I said, we'll share links with some of the guidances that have come out about what to do in shelter settings and congregate living settings, as well as general guidance for how to keep people safe if they have a family member that has the MPX. Okay. All right. So another sexually transmitted disease that's very concerning is congenital syphilis. And I wish I could say that trends are looking better with this, but despite the fact that we've known about syphilis and the congenital syphilis issue here in the Central Valley for many years, we're not really winning this one. We need to be doing more as a community because we continue to diagnose syphilis way too late, and we continue to have kids that are born with congenital syphilis. This is a lifelong and sometimes devastating diagnosis, and it's so easily treatable that it's really doubly tragic for that reason. So we're putting out an advisory to just give you good information. Thank you to Dr. Robin Lynchite and to everyone who worked on this. This advisory will basically let you know that all pregnant women need to be screened. They should be screened at the very first time they find out that they're pregnant, the first prenatal visit, 28 weeks of gestational age, and at the time of delivery. Those are the 3 time points at which they should be screened. And we know that the majority of these patients that basically have babies born with congenital syphilis have inadequate or prenatal care, but they do frequently get seen in emergency departments. And so the emergency department is another place to really do kind of a universal testing paradigm where you just screen people for really all the STDs, but especially syphilis, to whenever you get pregnant women in the ED or urgent care, et cetera. You've really got to check them for syphilis to make sure that you're not missing that, because that may be the one and only time that they have an encounter with a clinician before their baby is born. And so that's a really important chance for us to intervene early on and really prevent the complications from setting in. Okay. Entering a correctional facility, all sexually active pregnant, potentially pregnant women, so women of childbearing age that are sexually active. If they have HIV or other STDs, check them for syphilis. If they have substance use disorder, especially amphetamine use disorder, we know that makes people very higher risk for STDs. So they should also be checked for STDs. Okay. There's more information in this advisory about actually treating with, it's usually bicillin unless the person's allergic. And there's really nice documents from CDPH that show people exactly how to treat it with or without the penicillin allergy, and what to do with the child if the child is born with congenital syphilis. So that all of those documents will also be in this advisory. And if you have any questions, we have lots of experts in communicable disease and perinatal care and substance use disorder. We're happy to help guide your care. Just reach out to us. We really want to hear from you. We know not everyone's going to be an expert in all of these topics. We just want you to know to get good information. And so that's why this advisory is getting put out there, because we all, like I said, as a medical community, this is kind of embarrassing. We all need to do better, and we all have a role to play regardless of what our discipline is, so that we can prevent more of these tragedies from happening. All right, I didn't have time to finish out this slide, but this is really just going to be kind of some miscellaneous updates related to Ebola, Salmonella, and some of the other issues that are coming up, including one called carbapenem-resistant organisms. So you'll remember Dr. Al actually did a whole lecture about this topic a few months ago, and now there's more webinars and information available about it. So I will just add that in for your reading pleasure over the weekend before we send out this slide set. For now, I think you should just know Salmonella is associated with meat and cheese products coming from Mexico. So we're basically, the CDC is advising, if you're traveling to Mexico, be careful what you eat. Make sure it's prepared safely. If you're in doubt, don't eat it. If patients come back from Mexico with Salmonella, symptoms, which is, just gastroenteritis and sepsis-like syndrome, then basically they should be screened and cultured for salmonella and treated. And there's just a strong link, which has been there. It's not super new, but it is something that is kind of ticking up. So if you have patients that are traveling, coming back from Mexico with gastroenteritis, et cetera, then think about this diagnosis. Same thing with Ebola, viral disease. It's probably not as common as malaria for someone who's a returning traveler, especially from the African continent. However, there is an outbreak in Uganda that's ongoing. And if patients are traveling back from there, they're going to be rerouted to one of 5 different airports in the US where they will get actively screened. But we know that if they're incubating and not symptomatic, that they will go on to, all 50 of the states, and then they may actually get symptomatic a little bit later on. So the health department needs to be tracking those individuals, and obviously the healthcare system as a whole will need to figure out a game plan for how to deal with that. We don't know if we don't know if and when this will ever kind of hit Fresno County, but we all just need to have situational awareness that it is something that's happening. It's gotten national attention. And if you want to spend an hour, hearing from the experts at the CDC, then this Coca-Cola is the best place to start, because they will just give you, the situational summary and then basically exactly what you need to know as a clinician about taking care of Ebola virus disease. All right, and last but not least, one of the things that I'm passionate about is opioid use disorder. You've heard me talk about this before, and really, I just want to boil it down to 3 simple questions: how do we prevent death after overdose? And the answer to that is Narcan. We know Narcan is basically something that can reverse the signs of opioid overdose, but it's not available everywhere. And that's really tragic, because although it's a great antidote, sometimes it's just offered too late. I'm here at the Poison Center today. 2 weeks ago, I reviewed a fatality case in a 17-year-old. She was found with blue residue in her mouth. So you're looking at pictures. These are not just theoretical concerns or something that's happening far away. This is happening here in Central California. She had a blue pill in her mouth. She might have thought it was Percocet or something else. And guess what? The urine drug screen showed that it was fentanyl. She was alive, but Narcan did not wake her up because she had already sustained hypoxemic brain damage. She was taken to the hospital, and after 3 days in a vegetative state, the family withdrew care. This is a 17-year-old who died. Okay, so this is happening. It's unfortunately not the only case that I know about that's happening here in Central California. And that's why, we're all trying to get this word out through the schools, through really the media, and really to all of our medical providers. Please have this conversation with your at-risk patients. If anyone is going out to the street to score drugs, it means they really need help, and they need us to really offer them legitimate resources. We need to make access to recovery easier than access to street drugs, or we're never going to get through this. At the bottom left, you see something that looks like candy. This is called rainbow fentanyl. This has also been found here in Central California and all over the US. Sometimes it comes in powder form, in which case it's called rainbow chalk. But either way, this is something that could really fool young children and adolescents into thinking that it's quite benign or, quite playful. It's absolutely not. It's quite deadly, and it's being found whenever the law enforcement agencies do these interceptions. And unfortunately, we always find out too late whenever these patients come to us after overdose. So that's why we're passionate about distributing Narcan. We need really every medical provider to just have it behind your counter and just hand it out when people ask you. That's really where we're trying to go. Schools are stepping up, and actually they want to offer it to their students and their staff, because we need to have this everywhere. And I just feel like our medical community is not where it needs to be, because too few of us are actually offering naloxone. Please reach out to me and we can talk about how we can make that happen. There's a state grant. It's a 2-page application. You can fill it out today and then have Narcan sent to you by the state that you can then turn around and hand out to your at-risk patients. But even Narcan, it's basically, only an intervention that happens after overdose. So the next question is, how do you prevent overdoses in the first place? And this is something that not a lot of us know about either. this is medication-assisted treatment. This is evidence-based, an evidence-based approach that actually keeps people from wanting to overdose in the first place. So if they have a problem with opioid use disorder, if they're really at risk of going out to the street and finding a drug dealer that's going to give them fentanyl, you can actually start them on medications that will prevent those cravings and take care of drug withdrawal. And that's all known as medication-assisted treatment. Why don't more doctors offer it? Well, it does require something called an X waiver. The X waiver takes 5 minutes and you can apply just going to that link. I'm happy to walk you through it. I helped X waiver an ER doctor. I timed it. It literally took 3 minutes. All you need is your DEA number and your California license number. And you just punch in that information. And then you basically can apply with a 3-minute application. And once you have your X waiver, then you can be part of the solution. You can actually start prescribing Suboxone. And any X waiver doctor can prescribe Suboxone. If a patient is taking Suboxone every day, then they're not going to go into withdrawal. If they do end up taking some fentanyl, the fentanyl is not going to actually affect their brain receptors. So this is basically a vaccine for fentanyl overdose. That's kind of how I think about it. And so really, while Narcan is important, this is probably even more important to really help those high-risk patients that are going out and using street drugs over and over and over again. This is really important to get people into recovery. And almost everyone that's doing primary care, certainly out of the emergency department, we can all be part of the solution by knowing about MAT and actually using it, instead of just sitting on the sidelines and saying, yes, it's sad, but what can we do about it? Well, this is what you can do about it. Narcan and MAT. And I hope you find out and take time to, invest in your own education so that you can start doing it. It's not hard, folks. It's not hard, but too few of us are doing it. And too many of these tragedies are happening over and over again, all over the country and here in Fresno County. All right. Well, with that, I wish you a safe and happy Halloween. It's always a pleasure to check in with all of you, and we have lots of time for questions and answers. So I will look at the chat, but please feel free to unmute yourselves and ask me anything if you have anything to share.
Hi, Dr. Vohra.
Hi, Letty.
I would like to do a little recap of National Lead Poison Prevention Week.
Thank you. Yes. Go ahead.
Yeah. As you can see, next week will be National Lead Poison Prevention Week, and we do have an existing program here at the Fresno County Department of Public Health that tracks elevated blood lead levels in children. I'm going to go ahead and share my screen, Dr. Vohra, if you don't mind. Just a little.
Go ahead. Yeah.
Yeah. Yeah, National Lead Poison Prevention Week is October 23rd through the 29th, and we do have a campaign going on right now through radio and social media. I'm going to share a slide of just what the numbers look like in Fresno County when it comes to elevated blood lead levels among children. As you can see, we have a little bit close to 1,000 children that we are monitoring, meaning home visits, phone calls, follow up with their provider to make sure that those blood lead levels are down, or just making sure that those levels go down and not higher than 4.5 micrograms per deciliter. We have around 800 children that we are monitoring with blood lead levels between 4.5 and 9.4, 140 between 9.5 and 14.4, and 19 children over 14.5. And we need 2 venous blood lead level in order to close the case, as long as they're below 4.5. So those 800 children, they're with us. They're here with us because they don't receive that venous blood lead level, that second venous blood lead level that they need in order for us below 4.5 in order for us to close that case. So please, very important, that second venous blood level is very, very important for these children and for those families. And we have, what we have right now is a campaign going on in 3 languages, English, Spanish, and Hmong, through our radio stations. And we have a billboard in Spanish in Fireball. We have, the reason we chose the west side of Fresno County to send this message is because we're not really getting tests from those providers in that west side of Fresno County. So we decided to put that message up in Fireball, and we have those digital ads going on right now. The digital ads look like this. We have them in English and Spanish. So when that digital ad pops up in a website that a internet user is using, then they can click on that digital ad, and then that click will take them to our website for more information. And this is what the billboard in Fireball looks like. It's out there. So what are we doing with these children that have elevated blood levels? We do have a great resource, and that is the HUD grant. This is funding for families to remediate their homes, because most of the time these children are being exposed to lead because of that old peeling paint found in those homes, dirt and dust. So if that family qualifies for this grant, our contractors can go out there and repaint their homes. So we do have that resource for those families with those children that are being exposed to lead. And that is the phone numbers. If you want to capture that phone number to give to families whose children have elevated blood levels, give them that phone number, give us a call, and we can go ahead and help them with the application and see if they qualify, they can get their house repainted. They don't have to own that home. If they rented, we are in contact with the owner of the home where the family live. So that is one great resource that we have right now. So we're hoping to spread that word through you using your office to send the family this message that there is help for those children that have elevated blood levels. And I want to share one more statistics with the group, and that is I'm going to stop sharing this.
These are great. Will you send me these slides, Letty, so we can put them in our
Yes, I will.
Slide set with everyone?
Yes. Let me go ahead and okay, this is a breakdown of the Can you see the slide, Dr. Vohra, and the rest? Yeah, this is the breakdown of tests being done in Fresno County. As you can see, they dropped dramatically. In 2012, Fresno County had a total of over 21,000 blood levels. And as you can see, as the years go by, in last year, 2021, we only had 12,824 lead tests that were performed here in Fresno County and were reported to the Fresno County Department of Public Health. So our goal is to increase testing for the next year. So we're going to be doing a lot of outreach with providers and just sending out messages about the importance of testing children between at 1 year of age and 2 years of age. So as you can see, the number of tests have dropped dramatically. So we want to go ahead and bring those numbers up. And we're going to be working very closely with pediatricians and CHDP providers to get those numbers up. And that's all I have. Thank you, Dr. Vohra, for the opportunity.
Thank you, Letty. Great information. We'll definitely share that out with everyone. Again, I'm at the Poison Center. We had the most interesting case I got yesterday was an older lady who had a lead level of 120. which is sky high. I mean, you know, Letty's talking about intervening when the lead level is greater than 4. This person had a lead of 120. And their source was the use of Indian medications, which are notorious. You know, even spices from India can have lead, but especially medications, Ayurvedic medications from India. There's a very strong association for lead contaminating or intentionally being used in those. And that's what this lady had been using. And unfortunately, you know, she came in with altered mental status and a lead level of greater than 100, which is almost life-threatening. So she had to actually not only get the removal of exposure, which in this case was dietary, not environmental, but also the treatment, which is chelation. And she had to get chelation therapy for getting the lead out of her body immediately. So just something interesting that we're working through here at Poison Control. Lead is very interesting. So I'm glad that we're focusing on it next week. And I'd love to have you talk about this during our media update next week as well, Letty. So thanks for all that you're doing. Any other questions or comments? And Sim is dropping the link to the phone number and the website in the chat. This is really a great program that's underutilized. It's basically free money to fix your house and renovate your house if you've got a problem with lead in a young child. And we're struggling to find folks who qualify for that grant. So please help us identify those families who can really use you know, some help with making their home safer and hopefully you know, nicer by getting that HUD grant. All right, well, it's Friday afternoon. It's a beautiful day out there. And I know all of you are just chomping at the bit to go finish out your Halloween costumes, or is that just me? But in either case, have a wonderful and happy Halloween. Stay safe, keep your families and your kids safe, and enjoy the fall weather. And we'll see you next time. And like I said, we'll send out these slides in just a little while this afternoon. Thank you all so much.
Thank you.
Take care.
Thank you.